do you view Neuralink as your biggest competitor? And what are some of the key differences between what you're trying to tackle and Neuralink is trying to tackle?
I think sometimes we compete for oxygen and maybe sometimes we compete for venture capital, but we're building for two very different reasons. I mean, Elon is on record saying like he sees BCI as this existential hedge against AI. And in his world, like he's completed his mission when everyone has a BCI and everyone has merged with AI. And so some of the design decisions that he built into this system reflect the idea that he wants a ubiquitous consumer level BCI. It's implanted by a robot rather than a neurosurgeon so that it can scale. The materials that they use can maybe be built at a low COGS. But also the devices aren't meant to last very many years because in kind of his world, you get a new phone every year and you're going to get a new BCI every year. We took a very different approach because we see our customer for the next 20 years being people who have unmet medical needs and want to get back to where they were before their injury or before their illness. And if you ask people who are getting a therapeutic device, look, what they will say is, I'm nervous about going into surgery. I don't want to get surgery, especially brain surgery. It's a serious thing. I will do it if it's going to help me and it's safe and if I won't have to do it again for a long time. And so as that is an input, we said, look, we want to build the highest data rate BCI we can to deliver the best outcomes to patients, but we also want to make a device that is going to last for a really long time. And so the biggest difference, I would say, between Paradromics and Neuralink are the two high data rate BCI companies in the world. We're the two companies that are building wireless platforms that can record from lots of neurons simultaneously. But we're very different in the sense that Neuralink is building a device that doesn't have a multi-year life expectancy. And Paradromics is building a device that our ideal is that could last for the lifetime of the patient. The last point that I would want to make is I think some people assume that if you're making a safer and more robust device, that you must be losing something somewhere. You must be sacrificing on the data rate. But we've benchmarked our systems at 130 bits per second, which is currently a world record for BCI information transfer rate. And no one else has even approached that number. Neuralink.
Can you just contextualize what that means?
Yeah. So just to give you a sense, like Neuralink's in their reports are saying that their device can transfer 10 bits per second of information, which is allowed for cursor control in like the best case scenarios. It's been 10 bits per second. And our system can deliver 13 times more data at a time. So it's a little bit like comparing, like dial-up modems and like DSL modems. Just like you had in the internet, certain modems can allow you to stream real-time video, and certain modems can allow you to have like a text conversation. And the capabilities of the systems will ultimately determine what applications and how many applications and how well they can do. We identified a first use case, restoring communication to people who can't communicate any longer. And then what happens is that we're providing in parallel devices to lots of clinical research groups. We're putting them out there and showing that they can do different things. And then those things unlock the next applications. And some of those applications can be much larger. But the key for us was to start in a place where we knew there was very high demand for the product. We knew the clinical risk was low. And so we knew that we could land in that starting market and it would be relatively low risk. But it's now a robust device that we have really high confidence in will last for a long time. And it's the highest data rate BCI on Earth.